So, good afternoon, everyone. We are going to start a new topic in neurology. Important enough, uh, you are going to see such patients more often, specifically in Indian population, that is termed as muscular dystrophy. Muscular, as the name suggests, related to muscles. This means dysfunction. It can be plus or minus. Most of the time, it's decrease. Minus. And trophy means tone. Yes. So change dysfunction in muscles, specifically related to tone of the muscle, that is muscular dystrophy. But we are studying about neurology. Why are we concerned about muscles? Because nerves without muscles and muscles without nerves are useless. કોઈ પણ movement જોઈએ તો nerves પણ intact હોવા જોઈએ, muscles પણ intact. Now going to muscles, the structural and basic unit of muscle is sarcomere. You already know. Yes. Sarcomere na hoy or sarcomere enough contractile na hoy, elastic na hoy, flexible na hoy, active myosin binding na થાય તો કોઈ પણ movement possible જ નથી. Yes, and for that ATP is needed. But this whole sarcomere structure, A band, Z band, L band, I band, all this are formed on something known as ground substance. Consider ground substance as the pillars on which the whole building stands. Yes. કોઈ પણ building ના જે પાયા હોય, that પાયા is ground substance. એની ઉપર building ઊભી રહી શકે, that is sarcomere. Yes. So if ground substance is changed, ground substance જો આપણે alter કરી નાખીએ, એકદમ change કરી નાખીએ, or it is weak, then even though sarcomere are good, building ગમે એટલી સારી હોય, પાયા સરખા ન હોય, ultimately it will fall. Yes, in our tone affect the tone of the muscle. So for this reason, the ground substance is mainly formed from one protein, which is essential. Yes, एक એવું protein છે बहुत જરૂરી છે for formation, proper formation of this ground substance. You need to remember the name. The name is dystrophy. Yes. This dystrophy protein, if it is absent completely or if it is present partially, it will help in formation of the ground substance, or you can say the whole normal muscle physiology and anatomy. Anatomy normal હશે, ground substance normal હશે, તો જ એની ઉપર sarcomere will be able to work. Yes, otherwise it will work. So if dystrophin, say for example, this is a dystrophin protein, half of it is absent, half of it is present, that will cause a disease, what we term as BMD, or Baker's muscular dystrophy. Baker's muscular dystrophy. But if it is absent completely, yes, it will be termed as DMD. Duchenne's muscular dystrophy. એટલે કે dystrophin જે પ્રોટીન હોવું જોઈએ મસલના normal structure form કરવા માટે absent છે જ નહીં body. Yes, it is related to gene or DNA, which is that we are going to see. But જો એ હોય જ નહીં તો શું થશે? There will be no formation of new muscle, normal muscle protein, no new normal muscle functioning. That means why it will be termed as muscular dystrophy. Muscular muscle dysfunction trophy related to tone. So change in the tone of the muscle because of any reason related to its synthesis. And a બનાવવા માટે જે proteins જોઈએ, જે normal basic structures જોઈએ એને બનાવવા માટે, each changed છે, ground substance changed છે. This is termed as muscular dystrophy. Now, before going into detail of what is it, most of them or majority of them are X-linked or sex-linked chromosomes responsible for such transmission of disease. એટલે ઘણા બધા આમાંથી disease એવા હશે જે
Okay, I'm so sorry. The network just went off.
Yes, please let me know what is sympathy, what is empathy, and what is the difference. Anything you can answer, that is fine. Sympathy એટલે શું? You can explain in Gujarati, that is fine also. Sympathy એટલે શું? Empathy એટલે શું? Or difference? From you, I want the answer from you. You can give an example and explain, that is fine. No need to give exact definition. Yes, please. What is sympathy? Sympathy એટલે શું? To sympathize with someone means, what does that mean? See, sympathy means to feel sorry for someone. If I had to describe sympathy in one word, I'm not taking dictionary level meanings, but I'm just saying.
Okay, I think someone just wrote something, that is sympathy means feeling sad for someone. Very true, very true.
So, to feel sorry for someone or certain situation, it may be for a person or maybe a situation also. Yes, that is sympathy. What is empathy? Can someone tell me what is empathy? You can answer yourself. It's completely fine. If it is wrong, I'll let you know. This is no exam. What is empathy? Empathy means not to feel sorry, but to understand the reason for a person's behavior or a situation. Yes. Why are we talking about this? This is not psychology. Yes, we are not in psychology, but still we are talking about sympathy and empathy. The only difference or why it is important to sympathy means to feel sorry for a person's behavior or person's situation. Say, for example, today I am very angry on you, and you see that, sir, I'm angry on, say, for example, CR of the class, that he did not send me the attendance, they are not maintaining the record exercise. Yes. So you will feel sorry for Purva being the CR. Let's say, for example. But if you understand why I scolded him, his work was not proper, my mood was not right, today something conflicting happens between us. To understand this and to see or talk to the CR, that is empathy. Now, here, why are we talking? More important, muscular dystrophy. Not always, but majority of the times, will predetermine. There are baby born fuse, diagnosed fuse, say for example, DMD, you already know the patient is not going to survive more than 20 years of age. It's predetermined. Yes, it is a progressive disease, which time it gets worse. Yes, DMD on the other hand, patient can live for up to 40 to 50 years of age. Because muscular dystrophy, 40 to 50 years of age. DMD, 25 or 30 is the max on which the patient can survive. Patient જ્યારે, as a physical therapist or a neurophysician is coming to you and you see the patient and at that time you know the diagnosis is DMD, fix the patient is going to die, you cannot help him much. So here you don't have to feel sorry for the patient. You are not supposed to be sympathetic. You have to be or you have to provide empathy. Empathy means to understand, to make the parents understand. Parents say counsel the problem. They see this is the situation, this is the disease that has happened, and you have to clearly tell them, do not give false hopes. Yes, 40 उम्मीद नहीं दिलानी parents through physical therapy or through drugs, of course, he'll live for 50, 60 years, he'll live a normal life, not possible. Yes, with time, independent chalta as a patient, he or she might have to use the cane, walker, and ultimately wheelchair. Yes, whenever this is one of the situations, one of the conditions in which physical therapy can only help maintain a specific path, cannot help in recovery. So here that is why we have to provide empathy and not sympathy. Oh, हमने तो DMD चाहिए, DMD patient में time नहीं दे सकते, they have to die. Nothing is such needed. Yes, we have to help the patient, understand the condition, and then provide the proper treatment. What is normal, what is abnormal. Yes. With these things in mind, you should always focus on the condition and the outcome measures which are you going to use for the patient. So, what is the cause of muscular dystrophy? So, first, most common inheritance, hereditary, from father, mother, directly comes to the child. Yes. Through what? Through dominant genes or recessive genes. You already know the DNA and the genes. Yes. DNA is a double helical structure. Yes. Double helical structure. One part of DNA, एक part DNA નો આપણે લઈએ, say for example this thing. If we see, આ એક region માં કેટલા બધા proteins હશે. Yes. So this is one gene. એક part DNA ના કહેવાય gene. Now genes can be GENES. Genes can be dominant or recessive. If a dominant gene is present, it will always express its character. But if dominant gene is not present, then only recessive gene can cause a or create a presence or expressive situation. Say for example, today, principal sir is absent in the building. Yes, so he is not able to coordinate for any reasons. So if principal sir is there, always this will be the commands. But if he is not there today, someone else, vice principal or anyone else, HODs take their place. So that is what is recessive gene. They can only express when dominant gene is absent. That is the main advantage. Most of the genes responsible for muscular dystrophy (MD) will be recessive type. એટલે જેટલી વાર dominant gene inherit થશે father or mother માંથી, એટલી વાર express નહીં થાય. Then they are count something as carrier. Yes. E જે પણ newly formed થશે, that will be carrier of the gene. Why? એમાં recessive gene છે, dominant છે. Dominant is not expressing muscular dystrophy, recessive is. So recessive આગળની generation બે recessive ભેગા થશે ત્યારે જ chance છે. So that is around 50%. Or if dominant is not present or dominant is the key, then there will be chance for 30%. એટલે કોઈ પણ carrier હોય અને specifically female, આપણે જે વાત થઈ કે it is sex linked chromosome. So at times males will be expressing the character, that is males will have muscular dystrophy. Females might gene પણ હશે તો પણ એ carrier ગણાય, એને express એમાં નથી થવાનું. પણ એના offspring માં જો male offspring will, there are chances 50% chances કે yes, the child will be having muscular dystrophy. So depends on the age when symptoms appear and the type of symptoms that develop. Initially, as we talked about, DMD is much more severe. DMD is comparatively less severe. Similarly, we are going to see symptoms ક્યારે start થાય છે. DMD ના symptoms initially 3 months or even 1 to 2 years માં પણ દેખાય છે. DMD it may start later on up to 5 or 10 years of age. Yes, then the patient realizes they have weakness, they have altered tone and everything, which are signs and symptoms we are going to see in detail. Risk. Because these are inherited disorders, risk include a family history of muscular dystrophy. Yes. From the maternal side or paternal side. Yes, from a father's side or mother's side. જો કોઈને પણ history હોય muscular dystrophy, that means the child is or at a higher risk of having the same disease again. How many people are affected? It is estimated below or between 50,000 and 250,000 are affected annually per year. And this is 1 per 3,500 live male births specifically. Yes, so koi પણ males આપણે જે વાત થઈ કે males are more prone because they are sex-linked chromosomes which express this disease. Sex-linked genes. Yes. So 1 per 3,500 live male birth patient. 3,500 જ્યારે છોકરા બોર્ન થશે એમાંથી એકને મસ્ક્યુલર ડિસ્ટ્રોફી હોવાના ચાન્સ છે. Out of this 3,500, one is susceptible to have muscular dystrophy. This is the chart. This is what you have to remember, the names, not the percentage. That is fine. You just have to see around 23%, or we can say 1/4 of the patients, all patients of muscular dystrophy are Duchenne's muscular dystrophy, DMD. Yes. Actually, this condition is very important to us. As patients, our class as a therapist also will come, as a physician, you will also see. That is Duchenne's muscular dystrophy. The next major one is Baker's muscular dystrophy, facioscapulohumeral dystrophy, limb girdle muscular dystrophy, congenital myopathy, myotonic dystrophy, congenital muscular dystrophy, spinal muscular dystrophy, and hereditary neuropathy. Remember the names which I am telling you. Duchenne's muscular dystrophy, of course, they are going to see in detail. Baker's muscular dystrophy, which is somewhat lighter version, you can say, or not so severe version of Duchenne's muscular dystrophy. We are also going to see facioscapulohumeral dystrophy. Fascio related to face, scapulo related to scapular, and humeral dystrophy. Humeral is shoulder. Yes, so three regions: face, scapula, and humerus. That is shoulder region. Third regions affected, that is facioscapulohumeral dystrophy. Limb girdle muscular dystrophy. Limb girdle. Yes, the shoulder and the hip. If they are affected first and then distal is the weakness start. That is limb girdle muscular dystrophy. And congenital myopathy or distal myopathy. Myopathy. Related to muscles, pathy, any alteration, any change, any pathology leading from congenital region. That is termed as congenital myopathy. Yes, so limb girdle, facioscapulohumeral, Baker, and Duchenne's. These are the main ones that we'll be discussing in detail. What are the clinical features and how do we diagnose? How do we know that the patient is having confirmation? And then about the medication part, surgery part, and even to some extent physical therapy part we are going to discuss. So if we define muscular dystrophy, so muscular dystrophy is a neurological group of inherited disorder organized by progressive degenerative muscle weakness and loss of muscle starting in childhood. Hamisha, it starts congenitally. It is inherited. Yes, inherited. It has been formed from the genes obtained from the father and the mother. So it is first of all inherited. Then second, it is always progressive. Patient may be healthy, coming to physical therapy department also, will live on a wheelchair and will eventually die. Progressive. Such a progressive DMD is within 5 to 6 years, patient from running will be bedridden. Yes, or even death can happen within those times. So it is a progressive degenerative muscle weakness, dystrophy, yes, and loss of muscle tissue which starts in the childhood. Up to 8 or 9, up to next 20 years, it is being diagnosed. All the muscular dystrophies we have. Affect the muscle strength and action. The Southi Badare. We see the three main aspects of the muscle: endurance, strength, and power. Yes, the Southi Badare affect the strength in muscular dystrophy. generalized or localized. Generalized or localized. Localized means dystrophy होता है. Say for example, distal aspects में होता है. Girdles में होता है. Limb girdle dystrophy. Yes. Facioscapulohumeral, that is completely localized. आज region में થાય છે તે ક્યાંય નથી. Yes, so it may be generalized or even localized. Skeletal muscles and other organs may be involved. So most of the time there will not be any involvement of other muscles or other sorry other organs, but muscles also supply the organs. We are talking about the smooth muscle. Yes, यहाँ पे तो आपने skeletal करी. We are just concerned about skeletal muscle, but we do know muscles of the heart, myocardium, as well as smooth muscles which control the many functions of the organ. Say for example digestion. Yes, so that are also part of the muscle and muscle બધા muscle નો ground substance તો સરખું હોય. આખા બોડીમાં dystrophy તો એટલું જ necessary છે. ત્યાં પણ development થાય, ત્યાં પણ signs and symptoms આવશે. It's not just related to skeletal muscle. It can involve other types of muscle, namely myocardium also, as well as smooth muscles. Limitation, difficulty with walking or maintaining posture, muscle spasm, neurological, behavioral, cardiac, and other functional limitation. So, difficulty with walking. This will always be the first one. When a patient manhood, developing phase now, you might be learning about in pediatrics the normal development of a child, milestones that they achieve at 3 months. So, 1 month, 2 months, 3 months, 6 months, 9 months, 1 year, 2 years. કયા કયા milestone achieve કરવા જોઈએ એમાં પણ ત્રણ આપે gross motor, fine motor, and speech or expression as per communication. So in that the first thing that any parent will observe, child તો આવીને નહીં કહે કે મને weakness લાગે છે, they will not also have speech. Yes, the first thing that the parent will complain of, the patient is not using one part of the body, or the patient is not able to move. Move in the sense he is not able to stand. Say for example, up to 11 months, standing is achieved. May that be dependent or independent. So 11 months my child jo na thai and 2 years it has been child is not standing. That means there is some problem in difficulty with walking or other normal growth function milestone achievement. So એમાં ઊભું જ ના થતું હોય તો walking, running તો પાછળ ના આવે. So 2 years the patient is not walking or running. That is a big threat that yes, there is some problem mainly related to central nervous system or maybe related to the muscle morphology. Maintaining posture, એક posture maintain ના કરી શકે. શું કામ ના કરી શકે? કોઈ પણ એક posture maintain કરવું હોય તો co-contraction is must. This co-contraction જેવી વસ્તુ ના હોય, core muscle and back extensors if they are not working properly, so basically કોઈ પણ action ના કરી. This one exercise. Since then, if the posture is to be maintained and if the patient is not able to, that means some amount of muscles is affected. Which side, how much, that all depends on once you go for furthermore diagnosis and muscle spasm. Yes, continuously muscle spasm. Spasm से तो pain but whenever you ask the patient or they try to do some activity, it will be painful. You can see from their face. Even though patient बोल ही नहीं सके. It is a small child, may that be of 5 years. Still, their speech may be normal, may not be normal, and at that time they regularly complain of pain. So muscle spasm is one of the neurological, behavioral, cardiac, neurological can also be affected. It will be an additional condition. Say, for example, cerebral palsy. Yes, you might be only going on with the cerebral palsy. You might know what is cerebral palsy. It is a non-progressive disease. Yes, એકવાર damage to brainમાં એટલું જ damage lifelong is. Yes, એ વસ્તુ નહીં છે. But here we talk about it always increases. It is a progressive condition. Yes. So with neurological signs and symptoms, for example, cerebral palsy, plus sometimes muscular dystrophy. The central nervous system and muscles when they involved, that also is a possibility. Behavioral, cardiac, and other functional limitations. Behavioral, because of continuous neurological symptoms, because of continuous such weaknesses, patient is not able to do things, and the parents are still forcing them to. Ultimately, what happens is behavior changes with time. Also, cardiac, we talked about smooth muscles and cardiac muscles. Their function also changes because they are also muscle. They also need the dystrophin protein for their better ground substance and better formation or maintaining of that ground substance. And functional limitations. Ultimately, patients have functions, ADLs, patients, which should be achieved with specific time. So, these are the main few signs and symptoms. So, limitation, that is difficulty with walking, maintaining posture, muscle spasm, neurological, behavior, cardiac and other functional limitations. આ બધી જ વસ્તુ DMD, BMD and other limb girdle dystrophies માં easily you will be able to identify. Just to show you how much and what will it look like. As the name suggests. See, this is normal biceps. You see, yes, the size, the belly. See the muscle belly. Yes, see the size. How much it is? What is the cross-sectional area of the whole muscle? See here, how much it has decreased. So this is biceps with muscular dystrophy. Also, normal biceps, brachii muscle, the whole muscle. Yes, and due to muscle atrophy, see, it has just a covering radius bone. Yes, of the muscle. That is what here. See the cross-sectional area. Here compare. You will be easily taking it out. Yes, the muscle has completely diminished or atrophied, and because of this, the name is muscle dystrophy or muscular dystrophy. Yes. So આપણે વાત કરી dystrophy. What is the function of dystrophy? Yes, dystrophy માં એવું તો શું છે કે જોઈએ તો જ આખું બોડી or આખું મસલ normally function. So here is the process. Dystrophin deficiency leads to abnormal cell membrane with increased transient local membrane disruption in of the calcium. Leads to activation of proteases enzymes. Altered calcium channel activity increase the inflow of the calcium, impaired calcium homeostasis, apoptosis and necrosis. Dystrophin નું મેઇન કામ છે કેલ્શિયમ મેટાબોલિઝમ. તો જ્યારે પણ જરૂર હશે ત્યારે કેલ્શિયમને ઇન્ફ્લો થવા મળશે સેલની અંદર. This is a cell. Whenever the body feels the DNA tells, nucleus tells, yes, now we need calcium, this will go in. Jare nutrition or jare dystrophin nahi koi body, then there is activation of calcium channels. This leads to inversion or more inflow of the calcium. Jare અંદર આવશે તો enzymes at the cell membrane protease increase થઈ જાય એટલે વધી જશે. This will again lead to lysis of this cell membrane. એટલે વધારામાં વધારે calcium અંદર આવતું જશે. વધારામાં વધારે calcium leads to calcium toxicity. એટલું લેવલ વધી જશે સેલ કામ કરવાનું બંધ કરી દેશે. This is also termed as necrosis or cell death. Yes, એટલે કે muscle cells જે ફોર્મ કરવાના હોય muscles they will become useless, they will die. And because of this there will be no normal muscle morphology or physiology also. Like a dystrophin deficiency leads to abnormal cell membrane with increased transient local membrane disruption and inflow of the calcium. Calcium અંદર આવશે એના લીધે protease activate થશે. Protease activate થશે એનાથી વધારે calcium અંદર આવશે. વધારે calcium અંદર આવશે એટલે વધારે protease પણ activate થશે. તે lysis કરતું જશે આખા cell membrane. That leads to impaired calcium homeostasis. Like calcium membrane વધતું જશે and that will lead to apoptosis and ultimately necrosis of the whole cell. Cell આખું damage થઈ જશે, will be useless and the muscle anatomy and physiology will be affected. Okay, fine. So we'll keep it till here. Yes, we won't move forward. These are just the names. If you can remember, these are the terms we are going to use. These are the muscular conditions we are going to use. And more importantly, as a neurophysician and as a physical therapy, આપણને ખબર હોવી જોઈએ which type involves which muscles. એટલી તો ખબર હોવી જોઈએ. Yes, what are the changes? Of course, યાદ રાખવું જ આપણે common છે. પણ કઈ conditionમાં કયા muscle સૌથી વધારે affected થાય છે? That is more of. So, Duchenne's muscular dystrophy, Baker's muscular dystrophy, congenital muscular dystrophy, limb girdle muscular dystrophy, facioscapulohumeral muscular dystrophy, hemispheral muscular dystrophy, distal muscular dystrophy, myotonic muscular dystrophy, and oculopharyngeal muscular dystrophy. Most of them are based on the regions. The regions affect most of them in the region, but there are exceptions. Of course, the regional Baker, they might be, and you can take myotonic. So which are those we are going to see in detail one by one. So we'll start in the next lecture about the Duchenne's muscular dystrophy, move forward to further group classifications and see which region is affected where. Yes. Any doubts till now? We just described a few things. The first one was cause, second is the risk factors, why it may develop in certain population. Then we saw the types or the names of the diseases that we are going to see. Then we talked about the definition of the muscular dystrophy and the main limitation, why the patient will complain or what will be the initial signs and symptoms. And later on, we described about the process or what happens when there is no dystrophy. Dystrophy, when there is absent, then what does it cause? That is the main reason of that happening. And these are the names of the diseases that are important. These are not all names. But these types are there are still many types, but these are most common under decreasing order weaknesses. So, જ્યારે પણ dystrophy એવી પણ આવે કે you have not heard of it, they based on some scientists or based on some region body, does not mean it does not exist because you have not learned. Yes, it has, it is there. There are many furthermore types, classification, but these are most important. We see in the clinics, we see in the population nearby. That is why we are going to learn these in detail. Any doubts you have right now? Please let me know. Write in the chat yes or no. You have doubt, but please don't wait.